You know that moment when you suddenly get a pain in your knee, maybe when you're turning quickly,
Uh-huh.
or it feels like something's catching inside when you try to stretch it out?
Yeah, that catching feeling is pretty common.
It really is. Today on the deep dive, we're zeroing in on meniscal tears. You've likely heard the term, maybe if you're active or know someone who is, but what's the real story behind them?
Exactly. And our goal, in this deep dive is to give you a clear, concise understanding.
Right.
We want to cover meniscal tears, everything from what they actually are to how they're typically handled. We've sifted through quite a bit of information to bring you the key points.
So if you suspect a problem, you'll have a much better idea of what might be going on.
Hopefully. Yeah.
And this really matters, doesn't it? Knee pain can throw a real wrench in your day-to-day life.
Oh, absolutely. Whether you're like a serious athlete or just trying to get around comfortably.
So understanding a potential cause, like a meniscal tear, is that really crucial first step toward feeling better and, well, making informed choices.
Definitely.
So let's jump right in. When we talk about a meniscal tear, what exactly are we defining?
Okay, let's unpack this. Meniscal tears are basically rips or breaks in the menisci.
Okay.
Think of these as two C-shaped pads of cartilage inside your knee joint.
Right, between the bones.
Exactly, between your thigh bone, the femur, and your shin bone, the tibia. They act like shock absorbers.
Ah, okay.
Now, these tears can happen because of a sudden injury. Those are traumatic tears.
Yeah.
Or they can develop gradually, wear and tear. Those are degenerative tears.
So different causes.
Yeah, and a tear can be a small nick, a partial tear, or it can go all the way through, a complete tear.
Mm.
Plus, they can occur in different parts of the meniscus, like the inner curve or the outer edge.
Shock absorbers for the knees, that's a really helpful way to picture them. So if these shock absorbers get torn, what are they supposed to be doing in a healthy knee? Why does it cause problems?
That's a key question. The menisci have several vital roles. First, they help with load transmission. Tibiofemoral load transmission is the term. Imagine them spreading the weight evenly across your knee when you stand or walk.
Right, distributing the force.
Precisely. They're also crucial for shock absorption, cushioning impacts. Then, they aid in joint lubrication, helping everything glide smoothly.
Makes sense.
And they contribute to the overall stability of your knee. So you can see how a tear can disrupt all these important functions.
Our sources also mention meniscal root tears. That sounds quite specific. What makes them different?
Good point. Yeah, meniscal root tears are a particular kind. They happen right where the meniscus attaches to the bone.
That the root.
Exactly. Typically within about 1 centimeter of that attachment point. Sometimes the root can even pull away from the bone completely. That's called a bony avulsion.
Wow.
What's really interesting here, biomechanically speaking, is that a root tear acts very much like having the entire meniscus removed.
Really? The whole thing?
Functionally, yes. It dramatically reduces the contact area between the bones and leads to a huge increase in pressure in that part of the joint.
Okay, that sounds like it could have pretty significant consequences down the line. So how do these tears, these meniscal tears, actually happen? What causes them?
Well, like we touched on, there are mainly two routes: acute trauma or degenerative changes.
Okay.
Acute trauma usually involves a sudden, forceful, twisting or pivoting motion of your knee, often when your foot is planted firmly on the ground.
Like in sports?
Exactly. Think suddenly changing direction in football or basketball. That puts tremendous stress on the meniscus, potentially causing a tear.
And the other type? Degenerative.
Degenerative tears are more about gradual wear and tear over time. Years of use, repetitive stress, maybe underlying conditions like osteoarthritis.
Ah, arthritis, right.
Yeah, the meniscus can weaken and just become more prone to tearing, even with relatively minor movements or minimal force.
So a young, active person might get one from a specific, maybe quite dramatic injury, while an older individual could develop one more gradually.
Precisely. For acute tears, it's often that twisting or pivoting in someone younger, more active. But for degenerative tears, it could be something as simple as, I don't know, an awkward twist getting up from a chair.
Really? That minor?
Yeah, in someone middle-aged or older whose meniscus has already weakened over time.
That makes sense. Are there certain things that make someone more likely to get a meniscal tear? What are the risk factors?
Yes, definitely several risk factors. Participating in sports with those sudden, forceful knee motions, football, basketball are classic examples, significantly increases the risk of traumatic tears.
Okay.
A history of any previous knee injuries is also a big one.
Right, past damage.
Yeah, the structures might just be more vulnerable. Older age is a key risk factor for the degenerative type because cartilage naturally loses some resilience as we age.
Makes sense.
And finally, any condition that weakens the meniscus, with osteoarthritis being a prime example, also increases the likelihood.
So if you're an aging athlete with a previous knee injury,
You're sort of facing a perfect storm scenario for a potential meniscal tear, yeah.
okay, we understand what they are, who's at risk. Now, how do these tears actually develop inside the body? What's the pathophysiology?
Well, with traumatic tears, it's really about that external force just overwhelming the tissue's strength.
Too much force, too fast.
Exactly. The sudden, excessive pressure causes the cartilage to tear, a bit like stretching a rubber band too far until it snaps.
Got it.
In degenerative tears, it's a more gradual process. The cartilage kind of loses its structural integrity due to aging. It might get thinner, less elastic, develop microscopic tears over time.
So it wears down.
Right. And eventually, even a minor stress can cause a more significant tear. In both cases, the tear then interferes with the knee's normal mechanics and function, leading to the symptoms and potential complications we can talk about.
Okay, so if someone comes in with knee pain, how do doctors figure out if it is a meniscal tear and not something else? What's the differential diagnosis?
That's a really important point. What else could it be? Knee pain can stem from various issues, so differentiating is crucial.
Right.
Other conditions that can mimic a meniscal tear include, well, other ligament injuries like an ACL tear. We actually did a deep dive on knee ligament injuries previously, if you want to check that out.
Good reminder.
Then there's patellofemoral pain syndrome, pain around the kneecap. Osteoarthritis itself, obviously, is a common cause of knee pain. And things like bursitis, which is inflammation of the little fluid sacs, or tendinopathies, problems with the tendons around the knee.
Lots of possibilities.
There are. That's why a thorough clinical assessment, a detailed physical exam, and often an MRI scan are really essential to get the right diagnosis.
And the MRI helps see the meniscus itself.
Exactly. But it's key to remember that imaging findings must always be correlated with your actual symptoms. You can have findings on an MRI without having pain.
Right, incidental findings. Okay. So how common are meniscal tears? Do we have much data?
Specific UK data is a bit limited, but we know they're common. Very common.
Affecting both groups, athletes and older people.
Yes, both athletes with traumatic injuries and older individuals with degenerative changes. Interestingly, the prevalence tends to go up with age.
Okay.
And statistically, men seem to be affected more often than women. The overall number of cases also seems to be rising.
Why is that?
Likely due to a couple of things. Increased participation in sports, maybe.
Yeah.
And definitely improvements in imaging technology like MRI, which just lets us spot these tears more easily.
Makes sense.
A conservative estimate for the UK suggests around 60 cases per 100,000 people each year. But it's widely thought that's probably an underestimation.
Okay. Right. So if someone thinks they might have a meniscal tear, what are the typical symptoms they might experience, the clinical features?
The most common things are knee pain, swelling, and stiffness. Pretty standard knee issue symptoms.
Oh, what's more specific?
Well, a really telltale sign is often a catching or locking sensation in the knee.
Ah, the catching you mentioned earlier.
Exactly. It might feel like something is physically getting stuck, making it hard to fully straighten or bend your leg.
Okay.
These symptoms can pop up right after an injury, or they might kind of come and go, especially during or after activity. Some people also get sudden, sharp pain if a little fragment of the torn meniscus gets trapped within the joint.
Ouch.
Yeah. Other things people report include popping sounds in the knee, a feeling of the knee giving way or buckling.
Instability.
Sort of, yeah. And pain, specifically, along the joint line, that space you can feel between the thigh and shin bones on the sides of your knee, right where the meniscus sits.
And what about swelling? Does that happen straight away?
That's a good point to clarify. Swelling with a meniscal tear usually develops more gradually.
How long?
Typically over, say, 2 to 36 hours. It's due to fluid buildup in the joint and effusion, extra joint fluid. And this swelling can sometimes be recurrent. It comes and goes.
Okay.
Now, if someone gets really rapid swelling, like within the first couple of hours of an injury,
Yes.
that might suggest something more like hamarthrosis, actual bleeding into the joint, or a very large, tense effusion. And that often points toward a more significant injury, maybe involving ligaments too.
Got it. Okay, so if someone has these symptoms, how do doctors actually investigate and confirm it's a meniscal tear?
Right. The diagnosis, it starts with a really thorough clinical evaluation. The doctor asks about your injury, your symptoms, how it happened.
Taking a history.
Exactly. Then comes the physical examination. There are specific tests, like McMurray's test and Abley's test, where the doctor manipulates the knee gently to try and provoke pain or a clicking sound that might indicate a tear.
Okay.
But the preferred imaging method, the one that really lets us see the meniscus and assess the tear, its location, size, severity, is magnetic resonance imaging, MRI.
The gold standard.
For soft tissues like the meniscus, yes, it gives a very detailed picture.
Any other scans, like x-rays?
Well, sometimes an X-ray is done first, especially if there's concern about a fracture. There are guidelines called the Ottawa Knee Rules that help decide if an X-ray is needed initially.
Okay.
But it's really important, as we said, to remember those incidental findings on MRI are common, even in people without pain. So the scan results always need to be put together with the clinical picture.
Makes sense. You mentioned something else. DGEM-ARC.
Ah, yes, DGM-ARC, Delayed Gadolinium Enhanced MRI of cartilage. It's not typically used just to diagnose a tear, but it can give information about the overall health of the knee cartilage itself. More specialized.
Okay. So let's say we've identified a meniscal tear. What happens next? What are the management options? I know there's that mnemonic, Pricer.
Yeah, Pricer is great for initial steps. Protect, rest, ice, compression, elevation, and crucially, rehabilitation. But the overall management really depends on several things.
Like what?
Like the type, size, and location of the tear, how bad your symptoms are, and individual factors, your age, your activity level, your goals.
So it's tailored.
Very much so. Often, conservative treatment is tried first. That involves the RICE part of Pricer rest, ice, compression, elevation, plus pain management, maybe anti-inflammatories.
And physio.
Absolutely. Physiotherapy is key. Strengthening the muscles around the knee, especially the quads and hamstrings, improving range of motion, and general exercises.
What if that doesn't work, or if it's a bad pair, like one causing locking?
Right. For more severe tears, especially those causing the knee to lock up, or if symptoms just don't improve with conservative care, then a referral to an orthopedic surgeon is usually the next step.
Okay.
And what's interesting now is the evolving understanding of how important the meniscus is. There's a growing focus on trying to repair the meniscus whenever possible, rather than just removing the torn part.
Saving the meniscus. And if surgery is needed, what does that usually involve?
The main approach is arthroscopic surgery. It's minimally invasive.
Keyhole surgery.
Exactly. The surgeon makes small incisions, uses a tiny camera, the arthroscope, to see inside the knee.
And
during the procedure, depending on the tear, they might either repair it, stitching the torn edges together, if it's in a location with good blood supply and amenable to healing.
Okay.
Or they might perform a partial meniscectomy, where only the damaged, unstable portion of the meniscus is trimmed away and removed.
Got it. Repair or remove the bad bit.
Essentially, yes. And after surgery, that post-operative rehabilitation is absolutely crucial for recovery.
Back to physio.
Definitely. For milder cases, sometimes physiotherapy with a really good home exercise program might be the main approach from the start. But yes, surgical choices usually boil down to repair versus partial meniscectomy.
Are there other surgical options?
There are, though less common. Things like meniscal allograft transplantation, using a donor meniscus, or biodegradable scaffolds that aim to encourage new tissue growth. More complex procedures for specific situations.
And you mentioned urgent referral for locking.
Yes, if the knee is truly locked, or symptoms are severe and persistent despite initial management, seeing an orthopedic surgeon promptly is important.
Okay, so what can someone expect after diagnosis and treatment? What's the prognosis? And are there potential complications to be aware of?
The prognosis really varies. It depends heavily on those factors we mentioned: the tear type, location, the treatment chosen, individual factors like age, health, and how well you stick to the rehab program.
So no single answer?
Not really, no.
Yeah.
But with appropriate management, many people get significant relief from their symptoms and much improved function in their knee.
That's good news. What about downsides? Complications?
Potential complications can include things like ongoing pain, unfortunately. Sometimes the tear can happen again, a re-tear. There can be issues related directly to the surgery itself, like infection, though rare.
And long term.
And in the long term, particularly if a significant portion of the meniscus was removed, there's an increased risk of developing knee osteoarthritis later on.
Because the shock absorber is compromised.
Precisely. That's another reason why early diagnosis and prompt, appropriate treatment repairing when possible are so important. Better outcomes, hopefully fewer complications down the road.
And getting back to activities, how long does that take?
Again, it really depends on the treatment, conservative versus surgery, repair versus meniscectomy, and how the individual recovers. Rehab timelines vary quite a bit.
Okay. So, to summarize then, We've taken a real deep dive into meniscal tears. We've covered what they are, those crucial C-shaped cartilage pads.
Those shock
Yeah, the
absorbers.
shock absorbers in your knee. We talked about the common causes from sudden injuries to that gradual wear and tear.
Right, traumatic versus degenerative.
The key symptoms to watch for pain, swelling, and especially that characteristic catching or locking feeling.
Yeah.
And the range of management options, from rest and rehab using Pricer, all the way to surgical repair or removal.
It's a spectrum of treatment.
Absolutely. Understanding these key aspects gives you, the listener, a really solid foundation for navigating this common knee issue.
Exactly. And considering how truly vital the menisci are for overall knee health, acting as those shock absorbers, helping with stability, it does lead to a valuable thought for you to consider.
Oh.
Yeah, what proactive steps can you personally take to maintain your knee health, regardless of your current activity level? Thinking about prevention, maybe.
Some excellent food for thought there. And if you do want to explore more about musculoskeletal conditions or find valuable resources for learning and revision,
Especially if you're preparing for exams.
definitely. Be sure to visit passamsra.com. You can also find a wealth of free materials over at freemsra.com.
Great resources on both sites.
Thanks so much for joining us for this deep dive.
Our pleasure.
And we look forward to exploring another interesting topic with you next time.